What's up guys, it's Shay. Welcome back to my channel. If you are new, thanks for coming through, and if you're back, hey sis, I know it's been a minute and I know this is a well-awaited video. Today I'm going to be doing my fall semester recap. We're going to keep it organized for you guys today. So I'm going to talk to you about the courses I took this semester, what were 3 pros, 3 cons, and what were the best resources that I used to pass this course. And along with that, you guys are going to get a little treat at the end of the video as far as my nurse practitioner student updates. A lot of you guys have been flooding my inbox. When am I done with my MSN? When am I done with my nurse practitioner degree? When am I taking boards? What specialty am I interested in, and am I deciding to go back for my DNP? I'm going to answer all those questions in the end of today's video, but make sure you stay tuned and follow the journey throughout this video so you can understand a lot of the reasoning behind some of the decisions I made. So let's go ahead and jump into it. If you're not already subscribed, make sure you subscribe, and let's go ahead and get started. So I understand this video might be new for some of you guys. I've been doing MP journey videos on my channel for a while, so I encourage you to travel back a little bit so you can kind of see how I landed where I am. But quick synopsis on me, I'm Shay. I've been a nurse. It'll be this year for 5 years, and during my second year of nursing at the bedside, I decided that I wanted to go back to become a nurse practitioner. So in that decision, I've been taking you guys through the journey. I've been doing semester recaps, mid-semester recaps, and a little bit of vlogging to kind of show my experience with everything as an MP student. So that is just a little basis on me. So let's go ahead and talk about the courses that I took for my fall semester of 2021. If you guys see me look down, I have my notes ready to keep us on task, right? Because we ain't got time to waste. But the first course we're going to talk about is Adult 3 Clinical. So Adult 3 Clinical, I think, is so important that I discuss first because it is the juiciest for you guys. This is where if you are an MP student or thinking about becoming an MP student, I'm really going to give you guys some tea on how it went for me. So if any of you guys did not follow me during my clinical aspect of the semester, I was placed in cardiology for the semester. My past clinical experiences, I had 2 experiences of primary care. So developing into cardiology is one of the pros of taking this course, guys. It was very, very important and very crucial that I had a primary care, a generalized care background before I went into a specialty. I had some of my classmates and some of my friends who had specialties first and traveled back to primary care, and they really said that that was not, like, they did well, don't get me wrong, but it was not beneficial for their learning. So that was one of the pros I could definitely say about this semester. Another pro about the semester that I can definitely tell you guys is, as you know, I followed a nurse practitioner for 2 of my clinical semesters, and this semester I actually followed an MD. So it was very interesting to kind of see how not only you collaborate with an MD, but also the relationship between an MD and a nurse practitioner student. That had a lot of pros, but there was also some cons that I will talk about too. One of the last pros I will definitely talk to you guys about is just the demographics of cardiology and just the demographics of primary care in general. What I have learned, which I'm pretty sure this has already been like part of my motivation for what I am in school for, guys, is that we need a lot of representation in these fields, in these specialties. My preceptor mastered the fact that he was a minority, and not only that, but he was also able to speak another language, which I found that was very important for minority health. And I quickly realized too, as I communicated with patients from similar backgrounds to me, that it was important for me to be able to communicate with them in a way they understood, but also in a way where we could kind of, develop that interpersonal relationship, because that really will drive them to their best health. So with that being said, all of us in healthcare are important, but if you are a minority and you like healthcare, I really strive and encourage you to be a provider, because guys, there is a strong need for minority providers. Alright guys, so what would be better than to get into the cons? One thing I can definitely tell you guys as far as my cons is this semester, when I was with a MD who was amazing, who had lots of experience, and guys, I learned so much every day. One thing I could definitely see was the path of learning for a doctor is definitely different from the path of learning from a nurse practitioner. There are different priorities. There's not to say that one priority is better than the other. There's not one to say that one is smarter than the other. Of course, I will always respect that doctors go to school a lot longer than we do to get their degree. But there was never a time where we had any conflict, but I could definitely see the struggle with the pathways of learning when it came to taking care of patients, from me taking my nurse practitioner perspective from like bedside and also from having primary care versus what his thinking pattern and priorities were as an MD. Another thing I also kind of struggled just a little bit with was autonomy. My preceptor last semester, and this might just be because I had her for 2 semesters, was letting me go see patients, was letting me, you know, run the show pretty much towards the end of my rotation. As I started in this specialty, I had to bag back from the autonomy. One, I think just because my preceptor had to know what I could do and what I couldn't do, but also I think that union of understanding what the role of a nurse practitioner is still tough. So it was a little bit, I wouldn't say that it broke down my learning, but it was a little bit different of a challenge for me. And I think as we got towards the end of the semester, my preceptor did really help me grow. And he did kind of like cut loose some of the strands and let me do some things on my own. But there was always kind of a piece of, you know, a struggle with autonomy as I was in my clinical. Now, as far as resources, this will probably be some of you guys' favorite part of the video. But as far as clinical, you guys know I was in cardiology. So the first source I'm going to throw out here for you is this book is excellent. I've been reading it during my break. It is Rapid Interpretation of EKGs by last name Dubin or Dubin. I never say it right. This book, y'all, let me put it up for y'all. It's on Amazon for only $4. It takes EKGs and it breaks them down so well for you. It helps you understand what to look for in EKG, how to piece apart EKG, and also just all things you can think of that have to do with electrophysiology, but in a way where you can understand. It was always so hard for me during the semester to kind of understand. I understand parts of the EKG because I'm a telemetry nurse, but to understand what certain things on the EKG meant was hard. Once I got this book, I'm telling you, I don't like to use the word dumbed down, but this was an easy read for me and it really helped me understand. Y'all can see my bookmarkers in here. I'm actually going to go through this book for a second time. I don't think you have to be a cardiology specialty to read this. I think anyone who plans on being a provider for a patient, the heart is a big part of everything, no matter what specialty you go in. Primary, nephro, gastro, you need cardiac clearance before you get a colonoscopy, all those things. So I think this is just a good, easy read for anybody who plans on being a provider. There are 2 other resources I'm going to tell you guys about, and they're actually applications on my phone. If I'm able to put in a quick like screenshot of my phone here, I will. But the first app I want to talk about is MD Calc. MD Calc was so beneficial, especially being in a cardiology office. I was able to calculate cardiac risk factors. There is the Framingham tool or Framingham assessment for cardiovascular risk. While as a provider, you should probably know that by heart. It was so easy to just go into my MD Calc and kind of calculate scores. CHADVAS scores, so knowing if someone needs anticoagulation and knowing if someone needs to be started on a statin. All these were great tools in MD Calc. And of course, I also used Hippocrates for medications as well. Guys, my preceptor has been in the medical field for years, so much experience, and he uses Hippocrates all the time. He's like, I don't know what this med is, let's look it up. I would be cracking up. So that is part of even like your clinical tool to understand that in school you're gonna have to learn all this stuff, but it's not expected of you to know 100%, but you need to know where to go to get your information. Are y'all ready for the drama? Are y'all ready for the drama? Because the drama is about to be this next course I took for the semester. Alright guys, so my second course of the semester was Adult 3 Didactic. The class purpose or objective of Adult 3 Didactic in my program was to understand the patient in the geriatric or in older age. So we focused primarily on patients who are 65 and above. We talked a little bit about like, you know, geriatric syndrome. So that's stuff that will appear with older adults that you might not see with the classic middle-aged adult or younger adult. So it was very important that we took this course and that was the objective because, as y'all know, our baby boomers are booming and majority of our population now is over the age of 65. The second thing that I'm just thinking of now that I didn't even write down as a pro of this course is the fact that if you work bedside, you see a lot of these geriatric syndromes and patient care for the older adult a lot. So it was very comparable. For example, like we talked about like presentation of symptoms when it comes to certain issues. If I have a 28-year-old girl that has a UTI, she's going to have burning, she's going to have frequency, she's going to have complaints of pain, even some blood in her urine. If I have a 78-year-old female that has a UTI, the first thing I'm going to have is her daughter rolling her up in the hospital saying she's super confused, she's not making sense, she's not typically confused, she might have a fever, she might not, she might complain of burning, she might not. So it's just understanding how older adults present and how to figure out what's going on with them. The third pro of my program and this didactic class, guys, was the fact that we got to have an on-campus day. And I know I brought you guys through my OSCE last year. The OSCE was much different for us this year because we were all basically in that point where our professors kind of said, yeah, we're getting you ready for practice. So let's not test you on all this different stuff. We've done that already. Let's expand on your knowledge. So we did workshops that I felt were very beneficial. One of the first workshops we did was EKG interpretation, like I talked about before, and the other one, guys, my most favorite one that we did was suturing. They actually brought out like pig's feet. If I could insert some clips here. And they let us practice our suturing. They actually let us practice some of like the derm biopsies. I thought this was so beneficial. We don't get to see a lot of this stuff in clinical all the time. I was blessed to see my preceptor before suture and also take out sutures, but I never actually got to experience it myself. So I thought that was super dope, and I was super excited to experience that. I don't think I've experienced something like that since I had like anatomy and physiology in nursing school. Now, y'all, I'm gonna try to talk about the cons without crying, because this is why it took so long to do this recap, because I had to regroup. I had to get myself together. Guys, the first thing I will talk about as a con to this course, and remember, my experience may be different than yours, but throughout my course, they use different lecturers for different topics. And while that can be beneficial because you can see everyone's point of view, it's not always beneficial for me as the student and you as the person who's going to test me on the knowledge I need. So did this person teach me everything that you thought I should know, or did they not? And it just, I sometimes found myself, even though I'm doing a lot of self-teaching and self-learning in this program, it kind of brought some confusion into the picture when we had the different lecturers. The second, guys, thing was the test material. Now, let's be straightforward and frank in this video. My first exam, guys, was no bueno. I got under an 80. I was upset. My second exam, a little bit better, but still not too great. My second exam hit, guys, and I really hit this little state of depression in my nurse practitioner program where I thought I was not going to pass. I was like, this is it. I'm done. I can't even, you know, answer these questions the way I'm supposed to. I was just very upset. One thing I will tell you guys, and this is just a tidbit when you're going through things like this, one thing that I found very inspirational to me is to get on YouTube, Instagram, whatever platform, and find someone who's been through this journey like you have and watch their videos, watch their study routine, even if it's just them writing with a pencil. This stuff will get you motivated and keep you out of that depressive state so you can keep going. I ended this course with an A, y'all. My final exam, I blew it out the park. I was not playing. But it really took me understanding what the teacher would test on and also what was my best way of learning. The third thing I can say is definitely a pro and a con. We had these case studies, guys, throughout the semester that there were 6 in total and they were very lengthy. But honestly, what they were able to do is, even though they seemed like busy work, they were able to actually help any student that needed help in like grades situations. So it wasn't a lot of points, but it was able to boost you up a little bit so you would have a little bit of leeway when you're doing your exams and your other projects of the semester. So I ended this course doing well. I will talk to you guys about some of the resources I use, especially since I spoke of that hiccup that I hit in the middle of the semester. So the first resource that I'm going to talk about is this book called Geriatric Notes. This was literally a Bible, guys, during my semester. I won't lie to you, I did not touch this book the first test, and I put this book in my brain for the last test. So make sure you know your professor's resources. What are their best resources? Sit down and have those test recaps with them. Review your exam, ask them what the best tools are. They will give you hints if you take the time to show that you are interested, and you take the time to also sit down with them and tell them that, hey, look, I know I didn't do good, but what do I need to do good on my next exam? So this was big for us in my course. The second thing that was pretty okay for me in this course, I won't say it was golden because, again, I used this for my first test and I didn't do so well, but I still continued to use it throughout the semester. I just used it in a different way, was the Leak Certification Review Book. I think I have an old edition. I think this is the 3rd. I think they're on the 4th or the 5th now, so just make sure you check that. But I didn't use so much as the content information in the front. I kind of took the questions in the back of the book and I used them to test myself on the knowledge that we learned in class. They also have flashcards as well. I think I showed those in my vlogs. So I just kind of used this to test myself on information. The content is great, and I think the content is super important for, especially if you're studying for boards. But for some reason, for the test I was taking, it was not cutting it. The last thing I think you guys already know I'm going to talk about is Picmonic. I will put a little screenshot here from my phone. Picmonic was so important for getting me to understand basics, you guys. I had to do antibiotic review. Definitely use Picmonic. Talking about some of those geriatric syndromes, geriatric depression, I use Picmonic. And even going through some of the other things like pneumonia and cardiac issues, I use Picmonic. So I will say Picmonic is a great way to, after you know your content, so use your textbook, use your lecturer's like notes, go through that stuff and dig heavy, and then when you need to refresh or re-up and prepare for the test, go to Picmonic so that information can be reiterated to you. Alright guys, so this last course is going to be very brief, very straightforward. I decided to do the content heavy ones first just so we can get those out the way. So my 3rd course of the semester was research methods, and the purpose of this course was actually as a master prepare nurse to develop a research proposal. We didn't go through the whole thing of actually acting on the research proposal. As you know, that's a big component of the doctorate of nurse practice, but we kind of built the foundation to say, hey, if this is what you want to do next, this is how you would do it. And you should know these as a master prepared nurse, because there is some aspect where you should have that, you know, theory and research knowledge, even as you practice and as you grow, because evidence-based practice is a big part of your practice as a nurse practitioner. My pros of this course were it really challenged my views on things in the healthcare field. So you guys know I spoke a little bit before about being a provider that is a minority. I actually did my research proposal on racial consciousness in healthcare. I was afraid to do this at first because I didn't want to step on toes. I didn't want my professor to think I was like, you know, being this race crazed person. And she actually encouraged me to do this. And I actually developed a lot of knowledge that I did not know before when it comes to racial consciousness in healthcare and what we can do to kind of conquer it also. So I can also say the pro in that is that I wrote a proposal that was very controversial, but it was needed. So it really pushed me out of the box, not only as a future provider, but as a advocate for women, for minorities, for African Americans, and things like that. Lastly, the biggest pro of this course, I think I spoke of this when I talked about the nursing theory course, is the professor did an excellent job of developing the course in a way that helped you work at a pace to the point that when you got to the end of the semester, your research proposal was pretty much written completely. So there was like a week we had like our introduction due. There was a week we had our like literature review due, which is basically when you go into the database and you find all the literature that's out on your topic and you talk about that, and then you talk about the need for why your research proposal is needed. And then like each week, like the discussion boards that we did with our classmates and things like that were just little pieces of your paper, and you would get feedback from your colleagues and feedback also from your professor. So it was great to help you build that foundation. Like I got to the end of the semester, y'all, and my paper was done. I was like, oh, all I gotta do is bruise up a couple little things and I'm golden. I also enjoyed that we got the opportunity in this course to actually watch the proposal phase of 2 DNP students, or Doctorate of Nurse Practice students. So we were able to actually see them present their proposal and talk about how they were going to act on that proposal. And I think that was very beneficial in actually seeing how the work can be applied to practice. Some of the best resources I had for this course, of course, were the APA guidelines book. There's a book I will post here, and there's also Purdue OWL, which talks about the latest guidelines for APA. You need that for this course because that was a big portion of the paper, APA format and APA guidelines. The second thing that was very important for this course for me was the CINAHL database. I got a lot of my literature review and information to write my paper from that database, and I think CINAHL stands for Cumulative Index of Nursing something. I'll put it here, but if you are in any nursing courses, whether it's undergrad or graduate, that's a very good database for you to use to find some really good clinical evidence and also find some, you know, research and etc. I really had no major cons, guys, when it came to this course. I was actually very grateful that it wasn't too crazy and it was almost like a work at your own pace because I was so consumed with the adult 3 like didactic course, as you guys heard me talk about, and even the clinical, guys. People don't understand how much clinical affects just your lifestyle, because especially if you're a nurse that's working, it's like working an extra 2 days. It really takes a toll on your time, your body, and even that time you use to study. All right, y'all, I'm gonna go grab a quick little bit of water, and then let's talk about these lingering questions that you guys have, because I'm ready to talk about them. Okay, guys, so first question I know that's lingering is, am I done my MSN or my NP? So as far as my MSN, I have completed the clinical hours and courses to be able to sit to become a adult general nurse practitioner. So I am done my MSN. I'm done my Master's of Nursing. Yay, my degree is conferred. You know, we're gonna have the whole celebration here on the channel. But why am I not too, everybody's like, you're not so excited? Because I have a little bit more in my journey to go. So technically, I can sit for, like I said, the adult general nurse practitioner, but it was my choice to pick a program where if I wanted to sit for that, I had a choice, or I also had a choice to sit for family. Now, if I sit for family, I need pediatric hours and I need pediatric didactics. So that is my next game plan as far as what's next. So yes, I have a master's, but I just have a little bit to go, and what I'm doing is a post-master's. You do not have to do that. There's plenty of programs where you can fly through for your FNP. I chose this as a personal choice because I wanted the option when I got to the end, and I think I've made my choice. Next, I know a lot of you guys are wondering, what are my career plans as a NP? I told myself I didn't even want to get into this because I still have a little bit to go, but it is important that I sit and I think about it. So most of you guys might have known by watching my vlogs that after finishing 2 semesters of primary, I was gung-ho, 100% sure I was going to become a primary care nurse practitioner. Am I still gung-ho? I think that percentage has went probably to like 70%, and the only reason is because I got a taste of a specialty. And you guys know cardiology is my backbone. That's what I have experience in from inpatient. So when I went outpatient cardiology, it just hit it up a notch. Now, I will say at first when I got there, I was super overwhelmed and I was like, heck no, never doing a specialty, don't want to do this. I liked primary care more. But as I got in tune to what the provider does in cardiology, guys, cardiology is almost primary care itself, because you still have to think of all those other factors of the body that include the heart. But you guys know from my background, I've been a cardio nerd from day one. Now, I'm not saying that's the only specialty I'm interested in, and that's where we come into, you know, I'm not going to say it's a rock and a hard place, but I'm going to say that I'm going to have decisions to make after I take my boards. So there are some other specialties that I'm interested in, that I will share with you guys if I do end up, you know, going that route. But I think this clinical rotation really opened up my eyes to the fact that I could do a specialty. And there's a lot of rumors out there that as an FNP, you're kind of restricted. No, that is absolutely not. Even as an AGNP, you have a lot of options. So I definitely wanted to clear the air about that for a lot of you guys who are doing your nurse practitioner journey. I know the next thing too that I'm going to be asked, and I've been asked a lot, is, okay, when are you going back for your DMP? So guys, this is still something that is not on my goals list. I did understand a lot from taking that research course that it's a possibility that I would want to go back for my DNP, but I think as we all were when we finished our like BSN, or even if you finish your ADN, you'd be so burnt out from school that school is like all the way back there in the mind. I'm not even trying to think about that right now. So it's still a possibility, but it's not something that I'm going to promise is on my goals list, and it's not something that I think is a priority at this time. Now, if you're thinking about your DNP, go sis. Y'all know I never knock a girl that's trying to get it together. I just gotta figure out what I want and what would be my purpose in doing it. So it felt so good to sit down with you guys today and go through my fall semester recap. I am considered a master's of science in nursing, but I still got a little bit to go. But it just feels good because these are so many questions you guys have been DMing me about for a while, and I really wanted to just take the time to sit down and talk about everything so we can tie all the knots and put everything together. So if you have any questions about any of my didactic courses, please leave comments down below. Any questions about clinical, any questions about, you know, what my future plans are. One big thing I will tell you if you are an NP student is to make sure you network as much as you can. So when it comes time for you to get those preceptors, you're able to grab them. That is a big deal right now with my pediatric rotation, guys. And that's why AGMP is still an option for me. Even though I want to do my FNP, but it will still be an option because as you guys know with the pandemic, it's making it a lot harder to get those clinical placements. So make sure you're subscribed if you're not already subscribed. Comment down below, questions, comments, etc. Thank you guys so much for sitting down with me today, and I will see you in my next upload.